Wendy, you do have quorum whenever you would like to start. Richard did just email me and I forwarded him the link. There is Richard. All right, you are all good to start whenever you would like.
All right, good morning, everyone. Welcome to the Maricopa Regional Continuum of Care Committee meeting. For all participants, please mute your phone, but don't put it on hold during the call. Make sure you unmute to speak. We appreciate that housekeeping. For all participants, we ask that you please identify yourself by giving your name when speaking. As a reminder, committee members, please don't use the chat feature as it's not available for the public to see, and all information in the meeting must remain public. Richard Cruz and I are beginning our tenure as board chairs, co-chairs, and we wanted to start by doing a brief introduction. We now have 26 members on the committee, and we're hoping for a really productive year for us in our roles as committee members. My name is Wendy Johnson. I'm the Executive Director of Justa Center. We work with at-risk and homeless seniors over the age of 55. I want to hand this off to Richard to talk about our plans for the committee moving forward.
Awesome. Good morning, everybody. Hope you're feeling good and feeling great. My name is Richard Cruz, Director of Programs at the Human Services Campus. We are just really excited, Wendy and I, to be on this journey with you all. We are looking forward to an informed year that moves things forward. And when I say informed, my hope is that we get to hear your voices a lot as we discuss things. I believe that we are all extremely busy people and no one has time to sit on a Zoom and just look at each other. So I very much look forward to hearing from you all on the agenda. We don't have to wait till the after party to have conversation. We can talk right now. That being said, there will be a survey that goes out in the near future to you all, just to see what it is that your desires are. It is not our, we do not see this as this is our committee to a chair, but this is our committee to represent you all. And we want to move in the direction that you all inform us of. And so with that being said, we look forward to hearing from you. We look forward to your energy and our collective energy as we work together to do this most important work around ending homelessness. So I can do the next part, Wendy.
Thank you, Richard.
So now we're going to ask Katie to proceed with a roll call. Given this is our first meeting, we have 10 new members. That's exciting, right? Growth. We want you to please indicate that you are here, but we're going to put a little twist on it, put a little salt and pepper in it, a little paprika. And when you introduce yourself and your organization, we want one word, not one sentence, not one paragraph, not one dissertation, but one word that describes what you hope the committee can impact this year after Katie calls your name. So your name, your organization, so we know who you are because we don't all know each other. And then what's one word that describes what you hope the committee can impact this year after Katie calls your name. Everybody got it? We good? I'm shaking, I'm seeing thumbs up, I'm seeing nodding Nodding heads, all good. Okay, Katie.
Thanks, Richard. And I will tell you this is in alphabetical order. So sorry, beginning of the alphabet, you're put on the spot first. Don Bogart.
I was afraid of that. Good morning, everybody. I'm Dawn Bogart. I'm the CEO with Homeless Youth Connection. Oh, I don't know one word. Accomplishment.
Melody Boyer.
Melody Boyer, Section Chief for Homeless Programs at the Phoenix VA. Expansion.
I will also just apologize now if I butcher any of your names. Anna Verdugo for Vanessa Cartel.
Good morning. My name is Anna Verdugo. I'm the Housing Occupancy Supervisor for Arizona Behavioral Health Corporation. And it is kind of hard to pick one word. I guess community.
Sylvia Chavez.
Good morning, everyone. I'm Sylvia Chavez, a state coordinator for the Homeless Education Program with the Arizona Department of Education. And my one word would be outreach.
Allison Cook Davis.
Good morning. I'm Allison Cook Davis. I'm the Associate Director of Research at Morrison Institute for Public Policy at ASU. And my word is equity.
Erin Cohen-Hegg.
Good morning, everyone. I'm Erin Cohen-Hegg. I'm the Chief Program Officer at Save the Family, and my one word is collaboration.
Richard Cruz.
So Richard Cruz, Director of Programs, Human Services Campus, and my one word is possibilities.
Jessica Cruz.
Hi, good morning, everybody. My name is Jessica Cruz. I am the program manager over at the Housing Authority of Maricopa County. And I got to tell you, I thought I was going to be, of the first three people because my last name is Cruz. And so I chose several of the ones that you guys chose, but I'm going to go with inclusive.
Kathy Dinolfi.
Good morning, everyone. Kathy Dinolfi, Chief Program Officer at A New Leaf, and my one word is systems.
DC Ernst. Tish Gambino. Wendy Johnson.
Hi again, Executive Director, Justice Center. I love all your words. I am going for collaboration as well.
Anne-Marie Johnston.
Anne-Marie Johnston with Community Bridges, Director of Housing and Community Integration. And like many of you, my word was already taken, so I'm going to go with hope.
Christina Lopez.
Good morning, Christina Lopez, Program Manager for Permanent Supportive Housing with Native American Connections. My one word is going to be advocacy.
Marcy McFarland.
Hi, I'm Marcy McFarland. I'm the Director of Housing for Home Inc. For Central Arizona, and my word is progress.
Jim McPherson.
Hi, everyone. Jim McPherson. I'm Vice Chair of the Phoenix Community Alliance Social and Housing Advancement Committee, the longest title out there. I heard a lot of C words today, so I'll start with another one, compassion.
Jennifer Page.
Good morning. I'm Jennifer Page. I'm the Housing Integration Administrator for Mercy Care, and my word would be services.
Nikki Ramirez. Ty Rosensteel.
Hi, everybody. Ty Rosensteel. I'm a director at Solari Crisis and Human Services. We are the HMIS administrator for Maricopa County, and I will say data.
How fitting. Shayla Schuster.
Good morning, Taylor Schuster, System Improvement Advisor on the Built for Zero team at Community Solutions. And my word is transformation.
Sarah Sims. Laura Scott-Nicky.
Laura Scott-Nicky, Salvation Army Social Service Division Director. And my word would be expansion.
Lynn Spillers.
Good morning. My name is Lynn Spillers, and I am the Human Services Coordinator with City of Mesa. And my word would be partnerships.
Sorry, I had to find unmute. Michelle Stokes.
Good morning. I'm Michelle Stokes, CEO of Behold Charities, and my word is accessibility.
Craig Tripkin.
Hi, my name is Craig Tripkin. I'm Director of Business Development for CAS, and I've had like 5 words as I've gone here, and I should have written them all down so I had at least one in the top of my mind. My word would be connectivity.
Jocelyn Wilkinson.
Good morning, everyone. My name is Jocelyn Wilkinson. I'm the State Homeless Veteran Program Administrator for Arizona Department of Veteran Services. Oh, my word is justice.
Thank you, Jocelyn. Someone just joined us. I think it was Nikki.
Yes, that was me.
Hi, Nikki. We are sharing your name, organization, and one word that you hope to have the committee achieve this year. Not to put you on the spot.
Oh, goodness. And that's a big one. That's interesting. And not even knowing what everybody else has said. Committee achievements for this year. So first of all, I guess Nikki Ramirez, Director of Supportive Housing Services for Chicanos por la Causa, CPLC. And I guess my word, there's so many that come to mind. Let's just say perspective. I think widening perspective is very important. So I'll say that.
Awesome. Thanks, Nikki. And thanks all. Back to you, coaches.
Thank you. This also served as our roll call. So we want to make sure that we have captured everyone. Is anyone here that didn't speak? Okay, great. Do we need a motion to accept roll call? We don't, do we? I thought so. Okay, so let's move on to the next agenda item. Richard.
This technology. I have to call to the audience. Katie. Okay, we are going through it. Right. So an opportunity will be provided for members of the public to provide input through written comment to the Maricopa Regional Continuum of Care Committee on items that are not on the agenda, that are within the jurisdiction of MAG, or on items on the agenda for discussion, but not for action. Members of the public are asked to submit written comments related to this meeting through the MAG website at azmag.gov/comment and indicate for which meeting the comment is intended, or can choose to attend the meeting by registering through the MAG website at https://azmag.gov/event/31677. Comments may be sent at any time leading up to the meeting, but must be received at least 1 hour prior to the posted start time for the meeting. Comments received prior to the deadline will be read aloud during the meeting. Comments must not exceed 3 minutes in length. A total of 15 minutes will be provided for the call to the audience agenda item, unless the Maricopa Regional Continuum of Care Committee requests an exception to this limit. Please note that comments received for agenda items posted for action will be read at the time the item is heard. So for all of your folks that ask what happens in the meeting, or I want to say this, I want to say that, by all means, we have a space for them. So make sure that they connect. Tell them they don't just have to post about it on a Twitter, they can go ahead and talk about it in the meeting so we can hear it and have that be a part of our collective conversation. Wendy.
Thank you. I had a frog in my throat. MAG staff, were there any comments received or anyone who has joined the call to offer comments?
Madam Chair and Sir Chair, there were no comments received and no one at this time in the audience has raised their hand to offer public comment.
Thank you. We'll move on to the next agenda item, which is, and I apologize, this is our first meeting. Remember that Richard and I are still getting used to this. So our next item is approval of the December 8th, 21 meeting minutes. Does any member of the committee have questions or comments on the minutes, corrections, typos? All right. Could I have a motion to approve the December 8th, 2021 Maricopa Regional Continuum of Care Committee meeting minutes? Someone who was at the December meeting, please put the motion forward.
This is Ann Johnston from Community Bridges. I'll make a motion to approve.
Thank you, Ann. A second?
I can second that. This is Jennifer Page.
Thank you, Jennifer. Is there any discussion prior? All right, now I'll ask Katie to proceed with a roll call vote. It's very important that you state clearly how you vote, stating yay or nay after your name is called. Katie?
Dawn Bogart.
Yay.
Melody Boyer.
Yay.
Anna Verdugo.
Yay.
Sylvia Chavez.
Yay.
Allison Cook Davis.
Yay.
Erin Cohen Haig.
Yay.
Richard Cruz.
Yay.
Jessica Cruz.
Yay.
Kathy Dinolfi.
Yay.
DC Ernst. Tish Gambino. Wendy Johnson.
Yay.
Anne Marie Johnston.
Yay.
Christina Lopez.
Yay.
Marcy McFarland.
Yay.
Jim McPherson.
Yay.
Jennifer Page.
Yay.
Nikki Ramirez.
I think I need to abstain because I was not present during that meeting. My proxy was.
Ty Rosensteel.
Yay.
Sheila Schuster.
Yay.
Sarah Sims. Laura Scott Mickey.
Yay.
Lynn Spillers.
Yay.
Michelle Stokes.
Yay.
Craig Trupkin.
Yay.
Jocelyn Wilkinson.
Yay.
The motion passes unanimously with one abstention. Back to you, Chair.
Thank you. We can move on to the next item. Richard.
Awesome. So as you all know, members and subcommittees will provide a brief or verbal update on the recent activity as well as legislative activity. Additional updates can be found in the packet. This item was requested as an ongoing agenda item by the Maricopa Regional Continuum of Care Committee to remain informed about the work taking place legislatively in the various subcommittees. We have moved this update section to a written update and a brief verbal update provided by other committees for time-sensitive, important information. So this way, for those of you that want to get into the weeds, you can swim into the weeds. For those of you that really want to, but then what we would really talk about in this space is really the things that are pertinent so we can have real discussion on the issues that have been raised. So please read the written update and let staff know if you have any questions. Katie, she's going to be sending out an email with the legislative update following the meeting with a recap of the session opening and the coalition's legislative priorities for 2022. Given that right now there are no other time-sensitive updates, we will move to the next agenda item, which is the 2022 point time count. So I just want to pause for the cause really quick to make sure that everybody's clear with that before I move. Awesome. Okay. So with the point in time count, as you all know, each year the Maricopa County Continuum of Care completes the point in time count as a part of the requirement from the U.S. Department of as what we like to call HUD. We'll just call it HUD because that's what we call it. So from HUD, given the current spread of COVID-19, MAG is consulting with public health on the feasibility of conducting a 2022 pit count for the unsheltered portion. MAG staff will provide an update on what is planned for the 2022 pit homeless count, and then we want to have conversation at the end of this update. So I'm going to throw it over to Nikki Stevens, Regional Homeless Program Manager over at MAG, and she'll provide an update on the 2022 pit count.
Okay, so I've been reached out to by many community members, cities and towns around if we're still moving forward with the 2022 annual point in time count, and the answer is yes. As many of you know, we did receive a waiver from HUD last year due to COVID. This year, I've consulted multiple times with our local public health officials as been directed by HUD, and she's fairly confident that we can move forward with this. Just making sure that we have some protocols in place to stay safe. Obviously, our most important thing is your health and safety, and most importantly, the health and safety of the people that we serve that are unhoused and unsheltered. So, some of those precautions that we have discussed are to, if you have your meet outside, stay 6 feet apart. I would actually ask that you practice your questions ahead of time with your mask on, because it's going to be difficult to hear. As most of us know, when you're wearing a mask, it's difficult to communicate and hear. So practicing that with a partner, colleague, so that you're familiar with the questions and you're able to speak up with your mask on. Making sure your teams are small, 3, but 4 at the very max. Making sure that you're providing masks to the people that you're interviewing. As you know, they don't have the access to masks as we do. I do have about 1,000 masks that will be available and be distributed to the PIT coordinators that are being provided by the Maricopa County Human Services Department. So if you want to pick those up, I will be sending the email out the end of this week for a date that you can come pick those up from me in the downtown office in Phoenix. Please get vaccinated if you can. This is not a stance in any way, but please stay safe and get vaccinated if you can. Please no handshakes with the people that you're interviewing. And if you're not feeling well, please stay home. We don't need you out if you're going to be sick. We can make sure that we get a count as best as possible, but your health and safety is the most important, and the health and safety of those who are unsheltered. So if you're not feeling well or you tested positive for COVID, please stay home. Also, wear your mask at all times. Again, I will be providing masks if you need them, and also for distribution to the people that you will be interviewing. And I am open to any questions that anyone has. Thank you.
Awesome. Thank you, Nikki. Thank you so much. So I'm excited. I see.
Chair, I'm sorry to interrupt you. I just wanted to say this is an entirely paperless count this year. We're using the mobile app, and that is part of what the CDC recommend, or I'm sorry, not the CDC, our local public health official recommends as well. So I apologize, didn't mean to interrupt you. Just want to let everybody know it's totally paperless.
Awesome. Okay, so I saw hands up right away, so I'm excited about it. So I'm gonna go with the first hand that I saw, which was Jim's. So Jim, your question, or we'll go to you first.
Sure, thank you. Hi, Nikki. Thanks for that report and update. Another hat that I wear is with the board of the Arizona Partnership for Immunization, and the masks that have been out there currently need to be upgraded. With this Omicron variant, it's much more contagious. So I don't know about double masking, or a stronger mask needs to be thought about.
Good point, Jim. So there is a recommendation, as many of you know, of the N95 masks. I don't know exactly the kind of masks that are being provided by Maricopa County, but we'll find that out. But I agree with you. And obviously you're more of an expert than I am in that area, but I can consult again with our public health official. But yeah, if we don't have N95, maybe double masking is a great idea. Thank you.
Sheila.
Hi, Nikki. Just, I know you're not necessarily the only person to ask this, but do you know, are volunteers still needed? Are they?
So yes, I would say absolutely. I was reached out by some cities and towns who are struggling to get volunteers. So I would encourage you to reach out to me. And I also encourage that city to send me an email letting me know they need volunteers so we can get that information out to get volunteers throughout the valley. I know that, the city of Phoenix has a bulk of those, but there's other communities throughout Maricopa County that are in need of volunteers. Thank you for asking that, Shayla.
Yep.
Thank you. Wendy Johnson.
I was just going to say that if you're wearing the paper masks, you probably should, like Jim suggested, double mask and change them frequently. There's no shame in taking extra precautions, and we can work with some of the providers in town to make sure that Nikki has access to enough masks to be used. I know at Justa we have said no more cloth masks. They're not effective, and people were using things that had nothing more than fabric. I might as well have tied a t-shirt around my head. So we do need to practice what we preach out in the field. So you can reach out to Nikki or to Katie or me if you need supplies. We know where to get them.
Thank you, Wendy.
Thank you. Sylvia.
Being new to the MAG and the COC, is there a youth, or historically has there been a youth count or focus on youth?
So thank you. That's a great question, Sylvia. We are doing a youth, what's called a magnet event, and that will be held at the home base location. And I do have the flyer for that. And Sylvia, at our next youth provider meeting, I will provide the flyer to that, but I can send that out to you today. No problem at all. But yeah, there is a youth focused event that will be held by home base. It's going to be a barbecue to kind of entice the youth, because as we know, historically, it's really difficult to get a handle on that population during the point in time count. Great question.
Is that flyer also on our website?
You know what? Let me double check, but if not, we'll get that up on the website today.
Awesome.
So Melanie.
Yeah, hi. I have consulted with infectious diseases here at the Phoenix VA, and we are being advised to abstain from any group activities. My question is, have you guys also considered a waiver for this year as well, given the spread of this latest variant?
So HUD is not allowing a waiver this year. They're saying that we can push back the count, but I have been consulting, multiple times with our local public health official, and she feels fairly confident that we can move forward if we put these, precautions in place.
Thank you, Nikki. Michelle.
Could you provide the website that you're talking about?
Yes, I can provide that to you, Michelle. I will make sure that we send that out to you today. Thank you. It is on MAG's website under homeless point in time count, but I will make sure I send that out to you today. Thank you for asking.
Thank you, Nikki. Are there any other questions? I see no other hands raised. Going once, going twice, speak now, forever hold your peace. Okay, well, thank you so much, Nikki. With no other comments, we'll move on to the next agenda item. And for the next agenda item, that's number 6, the Homeless Management Information System team developed a dashboard that explores the inflow, active and outflow within the homeless system, the data, which was someone's word earlier today as far as what they wanted to see as impact. The data will be reviewed on a monthly basis at the COC meeting. TJ Reed, Regional Homelessness Projects Manager at Maricopa Association of Governments, will provide an overview of the system flow dashboard, and we will be reviewing the dashboard on a monthly basis moving forward. Go ahead, TJ.
Thank you, Richard. Committee, thanks so much for having us. So we're going to be reviewing this dashboard, like Richard said, every month. And the whole point of that is not to just look at the data, but is to see this information, ask questions, dig in a bit, and then provide any questions that you would like further review or answers on. We may not have them immediately, but the goal is for this to prompt discussion. And every month we talk about this, bring up questions, and look for areas for deeper dives. And then on a quarterly basis, the board has approved a synthesis of this information, as well as a couple of other items which this committee has seen. We have new members, so some of you may not have seen that, but this is meant to feed into that synthesis. So if we have questions, we have deep dives, those deep dives and summary of that information and questions being answered would go into this. I'll share some examples of questions and feedback we've gotten from other committees, from the data subcommittee and coordinated entry subcommittee. But that's really the context here, because that synthesis is going out publicly, and it's really meant to engage the public with viewing homelessness as not just a point in time, that our system is a flow. There's inflows, there are outflows. If there's 500 people experiencing homelessness and you provide 500 homes, that'd be amazing, but that does not end your homeless problem, because you have people coming into the system, right? And so the idea here is to shift the narrative from point in times to flow, and for us to really engage with the data more frequently. So more power to the person who said data as their word. Katie, can you go to the active overview tab? And then I may ask Ty to chime in here as well. The HMIS team has done a stellar and incredible job of putting this together. This amount of data is really incredible to have, and we're working with a lot of our different partners. I see Melody on, we've worked with the VA. We're looking at updating some of these figures as well to make sure that they are as accurate and reflective as possible. So what you'll see on this first tab, which all of you have access to this is not a public thing at this particular moment. We're not just sharing this out. This is for the COC work groups, the board, the committees, but you can look at this. So what you'll see on the top is the total number of actively homeless individuals by month. And so below that, you'll see subpopulation data. And all of this to say, I would question or ask you all if you have any questions. You can see that right in the very heaviest moment of COVID, right after, or I think it was around March, was our lowest numbers we've seen. There is speculation and some consideration to be made around policy implications made at the time related to shelter capacity decreases and decreases in outreach, being able to go and talk to as many people. And so inevitably, this list is filled with people interacting with the system, staying in shelter, talking with outreach, engaging with other systems. And with those limiting factors, you will, as we see here, a very low number. We actually saw our peak a couple of months ago. And Katie, can you scroll over the blue line on its lowest point and then on its highest point, just so we could see? So just to show you the impact that this made, there was about 2,800 in that lowest point that we saw. And then if you go to our highest point, when things were starting to pick up and go full force, they were at 5,400. So that is an incredible increase. Though the line for families is much more like steady, there's actually substantial increases there as well. And I'll just ask Katie if you can go under the lowest point there, like midway through 2020, is about 509. And that goes up to the highest point, which I think was like 776. So even though that line is a little bit more stable because the numbers above are thousands and these are hundreds, that is a substantial increase of households. And be mindful that the average family size is 3 to 3.5. So you're multiplying that 619 by about 3.5. And that's your family. So just as an overview, this is a narrative that you can see that how heavily COVID impacted our system, and that we are really getting back to a space where we're seeing some of where our services are at full capacity and our outreach is going full force at the moment. We're seeing the real impact of some of this. And so it's not just that we reset and it said, oh, well, prior to COVID, we're back to where we were prior to COVID. We're above that, right? And I think that's telling for us, is that COVID did not positively impact our homeless system, despite the fact that we are seeing substantial increases in funding for homelessness. I can only imagine what this would have looked like without much of that investment. And so the other thing that I wanted to mention here is shift over to the flow details page. So if you're looking at this on your own, this actually goes into the details of our inflows and outflows. It shows the active on the top still, so you can see that. But as you can imagine, anytime our inflow exceeds our outflow, our numbers are going to increase. And anytime our outflow exceeds the inflow, our numbers will lower. And so when you look at this, each of those, you can look at the inflow details to see what types of inflow. Are they new clients? Are they returning, et cetera? And then you can kind of just notice that and where they are. I really do like the second little chart there with the orange and the blue. So anytime that you see orange, that means the inflow exceeds the outflow. Anytime you see blue, that means the blue exceeded the inflow, which is great. So we see a lot of inflow increases, and that's obvious in that our numbers have continued to rise. So so right now, I'll just mention briefly a couple of questions that we got from others. So the data subcommittee put in a request in our meeting notes for the HMIS team to dig in further. But there was question about our, I think if you go to the engine tab, Katie, there was question about on the bottom, if you scroll all the way over to the right. So this top one right there is housing move-in date. Just the bottom one is fine. And so we're seeing roughly 100 to 120 housing move-ins through our system at this particular moment. The question was, why is this so low? Based on all the new investments, some of the new programs, and no substantial decreases in anything that we've seen. So there was a request to put together and ask this to a PSH work group and to start asking that. But the HMIS team will be digging in to see if this is a program level thing, that maybe some programs are underreporting, some are over. We obviously hear from housing providers right now that it's super tricky to move people in because the market is just crazy here. But that is an example of questions that have been brought up. And so any questions that you all have that you want to talk about now and also to look into further, we would love to have that. I see a couple of hands, but before that, Ty, I don't know if there's anything else you wanted to add just briefly on this. Again, that his team has done just an incredible job of putting all this together for us to even have this conversation. So kudos to you, but do you have anything, Ty?
Yeah, the only piece I would add, when you access the dashboard for our new members, if the presenter could go back to the information page, on the information page, it describes the definitions that TJ was going through, but then also it describes the inclusion criteria of who gets included in this report. And this is an HMIS generated report, so that is a known limitation. Not every person that is experiencing homelessness is in HMIS, but the criteria for being included on this representation and dashboard is very broad. So you can see that monthly by name list inclusion criteria at the bottom. There's 6 different ways that persons can show up in this overall process. So overall, the data is very comprehensive for the services that are available in our community. And although it isn't 100% representative, it is the best data that we have and the most live data that we have. So that's the only addition that I would have before turning it over to questions.
Thanks, Ty. Richard, I don't know if you want me to just call on people or if you want to handle it.
I got it.
Okay.
So Wendy, so I'm just going to go in order of how hands were raised. So Wendy Johnson.
Thank you, Richard. I'm curious, TJ and Ty, if there's a way to get some of a deeper dive in the return from housing on how long they were in housing, what triggered that, whatever we have access to, because that may come in under prevention. So that we don't see that number go up.
Sure. No, thank you, and good question, Wendy. And just for context as well, I think we likely can do that. We have specifically with veterans in the past done a bunch of deep dives into returns from housing. I will say it can be fruitful. There are some limitations in the data that we have because oftentimes you need to do some like qualitative or asking of the client because there may be gaps in that history that we're unaware of some of the things that were going on. So smaller bite-sized pieces can be really helpful with partnerships with providers to really start to understand why those are what they are. But great question.
Thank you.
Thank you. Next, Sheila.
Hi there. First of all, I want to say this is fabulous. Ty, great work on this. It's just, I love the visualization of this. And I would like to just give a little context too about I work at Community Solutions. We're part of the Built for Zero team. We've worked very closely around the data and the measures that the community pulls for. So I have a lot invested in this data and this information. And I have a couple of things that I just I'm curious about or want to dig into. One is kind of wearing my family hat. I do think it would be helpful at some point if we could see the number of individuals in families, because I think a lot of times, just in general, I see this nationally. So again, I don't work in Maricopa County, I actually work across the country and my agency does. But like a lot of times people think that family homelessness is a much smaller problem than it actually is, because the number of families versus the number of units is different. And I think the units are important because we do have to house families together. However, I think it's a more complex issue. And if there's just a way to project like the number of people in households so that people understand like that's actually a big chunk of our homelessness too, I think that would be helpful.
A good question, Sheila. And Ty, Katie, if you hover over, I believe, Ty, is that gone or?
Yeah, we have it in the engine for active all clients, but putting that on for each population is definitely a great suggestion, Shayla, and something that we have that data ready for. So
Awesome.
That's a pretty easy request. It's only going to be visible on this tab, the flow details, tracking people inflow and outflow. That's really much easier done on a per household status rather than trying to track the kids along with that. But at least on this page, you can expect that in the next quarter, we can make that enhancement.
Okay, great. And then one more thing is about so I just want to make sure I understand, and I'm sorry, this is going to be a long question and then you can answer at the end because it's probably 3 parts. So this information is available publicly and where we could access it. And then also like, I wonder, so something that I've been thinking a lot about nationally too, is like the idea of the data narrative to the community and how we share this information, because like, this is really helpful to us as homelessness response providers, but it's a lot of data for other people that maybe don't have the same context. And how are we sharing that story and what does that look like? And is there any plans to do that? And I would like to say that I would be more than happy to be part of any group that wanted to try to help talk about that and what that narrative looks like. But I do think that it would be helpful to like explain that, because so many people are like, well, you know, I just see these people on the street and this is our problem. And there's so much more context around it that I just wonder if there's thought around that or if that's already happening.
Yeah, great question, Shayla. And yes, and yes, and yes, I think. So when we first looked at this, that was the exact feedback that I think Ty and I had discussed personally, the data subcommittee had provided, and I think originally this committee as well, is this is a whole lot of data with a whole lot of definitions and a lot of context that is hard to interpret. And so that was the approval of the synthesis that would happen quarterly. And so that synthesis does exactly what you're describing, is it breaks this down by quarter, and there's a narrative section to each part that is really just broken down on a high level of what is happening. We're seeing increases here, and here's generally why. We also, and Katie, I don't know if you have that offhand. It might be useful to pull up, but I think we shared it last time. But Shayla, I can follow up with you afterwards and send you it if you haven't seen it. But that is exactly the idea, is to say, how do we break down this type of data in a way that is useful for the general public? Because this is not for the general public. This is for COC members in our committees and work groups. and the synthesis will be for anybody. So the synthesis would be similar to like the point in time reports that we produce, where it'd be like, oh yeah, we can talk to some of our members of the media who are interested in homelessness and wanting to understand what's going on, versus just giving them this, because you can take this so out of context if you're not careful. So, but great feedback, and I think that echoes the sentiment of a lot of other people in the community.
Anne Marie Johnson, sorry.
Hi, thank you. This is Anne Marie with Community Bridges. And I was just wondering, going back to the PSH Move-In Work Group, do we have an update on the work group and when that will be?
The PSH, the PSH Work Group, they were
For the move-in dates, yes.
For move-in dates. So if I don't know exactly what are you talking about, the ones where we're talking about internal transfers from one program to another?
Yes, that's correct.
Okay. Yeah, so I'm going to be sending out an email today. Actually, I talked to Jeremy yesterday about this too. We're going to be sending out an email today or by the end of business today to schedule a session with the HMIS team and with our permanent supportive housing providers specifically to recommend process for consideration at the data subcommittee. I think with that, there's considerations to make in the impact it has on system numbers. And so we know that it's happening. We know that we need to do it. The question is just how to do that effectively without impacting too many different things. And so, yeah, I'll be sending out an email today, and that will be looking to schedule likely in the next, hopefully by next week, but depending on people's schedules, it may be the following week.
Excellent. And then just the last question on that, who's going to be included on that email that you're going to be sending out?
I'm going from the HIC and pulling in all providers that have a permanent supportive housing project.
Excellent. Thank you, TJ.
No problem.
I'm going to go to Jim because Jim had his hand up earlier and they put it down. So I'm going to go to Jim now.
Okay, this is a newbie question, so I apologize. On this slide, I'm looking at the 619 number. Is that the number of families, or is that the number of individuals within the family category?
No, good question, and that's not, Jim, I don't think there are any newbie questions here. There's a lot of context here. So 619 is actually households. So if you, I don't recall the exact average household, but that was what Chayla was describing as well, that a lot of communities do it in this way. And there's reason why we do it in this way, but there's also limitations when you're looking at family numbers. It looks sort of artificially low because with this, you should be multiplying it by about 3.5, right? To really show everybody that's within the family.
So the total number of individuals, not households, will be higher?
Yeah, so if you were to count, and Ty referenced that we will be making this adjustment to show it on here. So if you were actually looking at all people just in general, including children, that number would be higher than that top level figure. It looks like Katie's looking for the.
Yeah, so that is accurate. So Katie went to this engine page that just shows all of the raw data. She filtered it for families and it shows the accurate numbers. So the 619 is in that far right-hand column as the total number of actively homeless households. Then right above that is the total number of all clients that would be in that family, which is 2,296. So significantly higher than the 619.
Yeah. Okay. So if you added those all together, Jim, then that would, effectively make our number 1,600 higher than it currently is.
Thank you.
Yeah, I'm going to go to Michelle Stokes.
Thank you. The question I have is, I noticed that you have the data broken down that include mental illness. I was wondering if there's data on other disability factors such as self-care, deaf and hard of hearing, or mobility?
Great questions, Michelle. We do not on this particular dashboard. I don't believe we have anything related to disability at this particular moment. I think we have received this question in the past, and I believe the response, and Ty, correct me if I'm wrong, was that there are a couple of options that if there is enough desire for us to put the disability on here, that is a potential option. The other is that we do deep dives periodically on that to share potentially a one pager of all the descriptions of disabilities, because it can be quite extensive in the amounts there are. But that's all I would say. And then I'll pass it to Ty. What are, I know we had talked about this, I think, once before.
Thanks, TJ. And thank you for the question. The biggest limitation that we have is that the detailed disability information is collected within HMIS, but it's not collected on every person. And so the fields that we have that are good representations across the entire system, it's not a field that is consistently collected. We have talked about there is a disability status of yes or no that is collected on every person, and that could be represented in the system flow as kind of a demographic breakdown, but we don't have that ability to do that for every client. So it would be, we would significantly undercount and underrepresent if we were to put that information on this dashboard. And so my recommendation is to have those types of questions be answered by kind of more targeted analysis rather than represented on this particular dashboard. It doesn't make it less relevant. It's just that it doesn't pair well with the other data that's on this presentation.
Thank you. It would be helpful just to help us know what type of accommodations to be focused on, whether accessible, wheelchair accessible housing, services for people who are deaf, that kind of thing.
Oh, that's really great feedback. Thank you so much, Michelle.
Laura, Scott, Nikki.
Morning. This kind of piggybacks on Shayla's comments and also Jim's comments, but I was curious when we're talking about telling our story to the community. On the families, obviously, I agree with Shayla that we do need to show how many individuals. But my other question is, on the number of active households by subpopulation, I can assume that the youth definition is a youth on their own. I think it would be helpful if there was a chart that showed the breakdown of ages of the number of people who are homeless in our community, because I think that there is a misnomer that it's the single individual on the street. And when you're looking at that 619 and the number of individuals in the household, I think it really needs to developmentally tell the story of how homelessness is affecting children in their development throughout their life.
Thank you, Laura. That's great feedback. And just to make a clarity point on that real quick. So are you suggesting then that the average age or just the age breakdowns would be inclusive of all children as well?
Yes, the second part.
Okay. Yeah, thank you. Thank you. Ty, did you have any thoughts on that one?
I think we need to take that one for review. We don't carry demographics of children into this report, just the demographics of the head of household. So there would be some data prep that would be needed to be able to answer that question. I think it's very relevant though, and definitely something meaningful and worthwhile to be when we describe the system as a whole. It's appropriate to describe all of the persons impacted by homelessness, not just the heads of household.
Well, and I think it goes to social determinants of health and the long-term cost on our system.
Absolutely. And I think you bring up a good point, Laura, of just like explaining the narrative too, that there may be some, because certain types of homelessness with youth and families and children are a little bit less visible than what a lot of people are seeing when it comes to, a lot of what we hear is like, this person is on the street panhandling, and that is our now reflection of what homelessness is in our entire community. And so shaping that, even though that does exist, there is also other types of homelessness that are experienced differently.
Yeah, I'm gonna go to Sheila.
I just wanted to say one more thing maybe too about this idea about communication or of the data. And I wonder, like, it's not in, and this is maybe food for thought or maybe a future discussion or agenda item, and it certainly includes the board, but like sort of the general communication plan around, you know, it's not just about like the numbers, it's like the story of homelessness in Maricopa County, and it does really involve the data. And I wonder like how we could as a community kind of be more ahead of that, and whether that's like more PR, more, you know, like stories, different things like that. And I think don't get me wrong, I think there are things happening, but I wonder if there's like more opportunities to be intentional about that. Or I don't know if the data subcommittee is already working on that, or if that's a different group, because it's not just the data, right? It's like this whole narrative around it. And I just wonder if there are opportunities and how people might plug into that are really interested in kind of telling that story. And I think it goes to everything that people said about social determinants of health, about the differences with youth and families, about chronic homelessness, about all those things. So I just want to put that out there that maybe there's an opportunity around really digging into some of that.
Yes, I think that's exactly right, Chayla. And we have like a general process that on a monthly basis, we're soliciting feedback and questions from each of the subcommittees, committees, and groups. And then on that quarterly basis, it would go through to the board for approval before. But I think what you're reflecting is perhaps like more emphasis on or more time and space to provide details and narrative around those items and feedback from particular people who may be interested. Am I understanding that right? I'm sorry, I don't know if you can hear my cat clawing at the door, but he is very interested in coming in right now to join this conversation. Sorry about that, everybody.
It's all good. Your cat's just excited about the conversation.
He is. He's an avid kid. So.
Data, right? So I do have a question that I have. So on this breakdown with the number of active households by subpopulation, I'd be really curious to see how how BIPOC disaggregates across each of these when it comes to being chronic, unsheltered, elderly, veterans, and youth. I think that there's a real story to be able to be told, as well as allowing us to have more directed, more targeted interventions when we understand exactly what that looks like. And I think there may be some assumptions that we have around what each of those populations looks like. But I think it'd be really helpful to see like how that BIPOC number breaks down across each of these different classifications.
Great feedback, Richard. And I'll make one point of clarity for the quarterly one, and then so one for the quarterly, we actually have compared it to county data as well and broken it down, not just in one category of BIPOC, but of each race and ethnicity that's listed in HMIS. And then secondly, I don't think we've had a plan to do what you're describing, which is go into detail of each of the subpopulations by race. And that I would say perhaps I'll defer to Ty on some of this. It might be quite cumbersome on one page to do all of that. So I'm wondering if that could be done periodically, or like special requests similar to the disability stuff that Ty was describing earlier of like, let's do a deep dive into the race and ethnicity of our subpopulations and share those findings with the group versus maybe adding it exactly to the dashboard. But I'll defer to Ty on that to see what is like feasible and what is doable visually.
So it's very doable. So for instance, you pointed about chronic. So we have 1,797 persons that were reported as chronically homeless last month. Getting the race and ethnicity of all those persons is very simple. That's an easy request. I think the question that we would need help with is what to do with that. So we can prep that data really easily to be able to have that available. But then, I would need some help on how could that turn into something usable? How could that turn into something actionable? How do we present that? And what's the format to present that? You could imagine, there's going to be just a lot of data that would come from that. So I'd be struggling with how to visualize that and how to make sure that it's in a way that's really usable. Does that make sense, Richard?
Yeah, fully. I'd love to have a conversation about that. And then I've got one more hand, Zanita Berry.
Jeremy, can you promote Zanetta into the meeting? I can't do that while sharing my screen.
Can you repeat that one more time, please?
Katie was asking if you could promote Zanetta Berry because she can't, because she's currently sharing her screen and she has a question that she'd like to ask.
Jeremy, she's in the audience. So we just need to promote her to a panelist.
She should be a panelist now.
Okay.
Zanetta, if you want to unmute yourself, then you should.
Yes.
be
It
able
looks
to.
like you had your hand raised.
Okay. Can you hear me now?
Yes, we can.
Okay, great. I just kind of want to piggyback on what you said about the BIPOC and what Tyler's comments were in regards to how that information can be used. I think for me as a youth provider, one of the things that information is resourceful for, especially when it comes to youth, is in regards to resource management and being able to identify targeted resources. And just my specific example is dealing with a young adult who had prior child welfare systematic engagement. However, because she was adopted, that limited her access to housing resource or housing funding. And so I think having the data on what they are, because she's biracial, both Hispanic and African American, but also being raised in a kinship placement, and knowing like the different systematic multi-systems that the historical data provides more of targeted resourcing in terms of what they can have access to regarding, FYI HUD housing or rental assistance. So I think those are ways that those tools can be useful in being able to target specific benefits towards whether it's ethnicity or systematic engagement.
Awesome. Thanks so much for the comments, Anetta. And I think that's really great feedback, specifically from a provider perspective of how that can be useful.
Definitely. Melody.
Thank you. I also just wanted to say this is something we discussed with the VA about 4 or 5 years ago. Just additionally to Richard's initial comment, we reviewed disproportionality and again reviewed resource management and refined some of our assessments because of that fact and help us to be better stewards of our resources and allocate more for the need. So I do think that in terms of justification for your argument, I think disproportionality is something that could help be addressed and also help us to direct what efforts need to be made.
And I just wonder, Ty, if based on the interest in this particular area, it definitely feels like an initial look at this would be really helpful to even note what Melody just said. Look at each of those subpopulations and see if they are reflective of the general population of homelessness, or if maybe youth has a much higher or disproportionate kind of makeup than older adults. So that would be a really interesting first look to see if there is any disproportionality, and if there is, then there can be much more review under that, even just as a starting point, regardless of what we want to do like kind of long term.
Okay, awesome. Yeah, like I would love it if, like, once we're able to be in person, it'd be phenomenal to do like a data walk around this and really like interact with the data and whatnot. Jocelyn Wilkinson.
I just wanted to, I don't know if this is something that you guys could do, but I was in a press conference with Zillow, a listening press conference, I should say, and they were talking about the amount of attempts that it takes. It was racial equity data that they had gathered on how many times it takes Black folks to rent from attempts to rent and brown folks attempts to rent from owners. And it was a 4 to 5 ratio with Black people and 6 to 7 attempts with Latino families. And so I said all that to say, is that something that data we can compile racially with the move-ins that we count, the time frame that it takes our families of color to move in versus the time frame from their counterparts. And I just think that would be good data to have around the amount of time they're allowed to search with their vouchers. If it's taken them these amount of attempts to locate housing, should we be giving extensions regularly? Just something to add to the repertoire to dive into.
Absolutely. And Ty, I don't know if you want to provide any feedback on the HMIS side. I would be wondering on the homing side of things, if there is some data on this as well from all your experience in administering vouchers and timeframes. I'm wondering if you would have anything like that from as a different data source from HMIS, because I think Ty can maybe speak to if there's opportunity to review some of what that would look like and the limitations, but also some of the value add of HMIS. But Marcy, it looks like you went off mute. I was wondering if you had any perspective on that, if that could be gleaned.
Well, it's certainly something that we could pull from our database. We do have our demographics reports, and we do have, it does break down on our performance screen on our website. So you can look to see, especially length of time that it takes for those individuals to be housed. So it's there, and I'd be happy to work with you, TJ, and Ty to provide you with the information that we have.
Awesome. Thanks so much. And for those who are curious, and if they want to look at that now, we can add it to the notes. But if you just go to homing.com, they have a performance tab and it has multiple dashboards, and they did add race and equity as a part of that. And so, well, kudos to you all, because I forgot about that. And then also, I think that would be really great to connect perhaps you and our HMIS team to see if there's something valuable that could be put there. But Ty, did you want to add anything from the HMIS lens? No? Okay.
No, I just that it's a worthwhile endeavor. We've done things like that before. It requires pretty significant lift in terms of the data preparation, but it's a worthwhile question and definitely doable. TJ, I would add that to our list of things that we need to prioritize doing as a data review.
Awesome, thanks, Ty.
Laura.
This is more of a community question. As we start to look at we've been looking at ending homelessness for 20 years, but now that more work is coming out on evictions and tracking evictions, is there a way to overlay some of the eviction rate numbers with the homeless rate numbers and the inflow and the outflow?
So I'll speak to what I know, and then Ty, if you want to chime in. So we get MAG specifically, I think it's also available to anybody who wants it from the county courts or the justice courts. They produce monthly numbers for evictions. So I think it would not be difficult to add monthly eviction rates on that for the county in particular to see if there are any kind of correlations between rises in. But one thing that we're seeing right now, which is mind-boggling to me, and I'm not quite sure how to understand it, to be frank, is there are surveys that have gone out that roughly about 1% of people who are in need of it are getting eviction prevention resources. Yet our eviction numbers have not yet reached what they were pre-pandemic, despite predictors and different groups saying that it would be a tsunami and that lots of evictions would happen. So in terms of the eviction numbers, we're seeing them low. There is anecdote and speculation, though, around why that's happening, and that there are some reasons that people may be effectively getting evicted, but it not going through the courts, in the sense of people are just not renewing rents because they're $200, $300, $400 higher than they were before. So you're not technically evicted, but there's no way that you're able to maintain, based on your income not changing, $300 more. And so I don't want to over explain all of that, but I think there's a lot of context beyond just the eviction numbers, which I'm not sure if there's exact data on some of. I mean, we could show like increases in rents, but I don't know how much data. I think Marcy, I even talked to Mike about this a little bit, if there's any data that we could share related to other aspects that are not showing up as evictions but are causing people to lose their housing. So I don't know if you wanted to chime in there at all either.
Yes, we are looking at this, now on a statewide level, not just in Maricopa County, but certainly we are focusing in on Maricopa County. But there are, to your point, a lot more properties are non-renewing. They're increasing the rents out of the reach of the FMR and even beyond the payment standards that we even go to. So, that is hitting a significant population or number of our participants, but also the new ownerships that are coming in, and they're rehabbing a lot of properties. So they're non-renewing so that they can fix up the properties. So we're seeing an increase in that, but we will have more data soon, and we're certainly working on this, like I said, with Maricopa County, but also on a statewide basis. So there's going to be more to come this month and next month on the studies that we've been doing. So more to share soon.
Thanks, Marcy. And I would love to connect with you all on that as well, because we're sharing some of the eviction data to our member agencies too. Great question, Laura.
Because I know that the public cannot see the chat. I just want to read this comment that was put into the chat from Zanetta Berry. I think that's exactly what's happening, that they are voluntary terminating leases as they increase rents in order to push tenants out, thus not having evictions.
Yeah.
We always have to look for the loopholes in the data. Michelle Stokes.
Just to echo what Marcy was saying regarding people with disabilities, I've heard multiple stories from people who are quadriplegic, people who are blind, who are facing that very thing, where they're non-renewable leases, and then the rent that's being proposed is $400 to $500 more than what they would be paying before, so they can't pay it. And then they're having to go live with other family members, they're moving out of state. And this is I'm starting to see more and more of that. And so I would like to encourage MAG to see if they could capture any data on that.
Yeah, I 100% agree, Michelle. And I think you just identified one of the most vulnerable populations where this would impact, especially people on fixed incomes, where there's not even an option to increase incomes there. So Marcy, I would just ask if you have any actual data, even if it's preliminary or draft, if you could shoot it over to me, as we are sharing. I think I have a presentation tomorrow sharing some eviction numbers, and the way that it looks right now, like you look at a lot of the data and everything looks great. Like it's like unemployment rates are going down, eviction rates are not yet pre-COVID, but we know that's not like the story. And so I don't want to wear rose-colored or provide a pair of rose-colored glasses to other people when that's not reality. because even with our homeless numbers, we're seeing our homeless numbers rise substantially over the last few months. So we know it's not just everything's peachy. So anything that you have that you could share sooner rather than later, even in draft form, would be wonderful.
Absolutely. I'll talk with you later today, TJ.
Thank you.
One last comment from Jim. Says staff members from the Arizona Supreme Court presented at yesterday's PCA Social and Housing Advancement Committee. They have their own dashboard on evictions. It may be an interesting and informative presentation for this group. Awesome. And then Jim, keep that in your pocket for agenda item 8, because that will definitely flow into that. If there are no other questions for TJ, we can move on to the next agenda item, but that was certainly a robust and energizing conversation.
Yeah, and Richard, if I may, I just want to say I'm super excited. Like, this was one of the most engaged conversations we've had on this data, and I think it shows the energy of this group, loving the new members and everything. So excited to work with you all on stuff like this, because this is really impactful.
Awesome. Thank you, TJ. So with the beginning of, yes, there's an ask to please share that link, Jim, so this way we can definitely have that. So with the beginning of the 2022, the committee will discuss work groups that should be started, the frequency of meetings, and members interested in attending. These work groups will be time limited, data driven, and goal driven, and report back to the committee. I'll just say it one more time: time limited, data driven, and goal driven, to report back to the committee. Beginning this year off, we wanted to have a discussion about the current work groups that are part of the committee and any new work groups that should be started to focus on the specific aspects of the committee's work. These work groups will be, again, time limited, data driven, and goal driven, allowing members to dig deeper into a specific thing such as system performance measures and report back to the committee. Do any members of the committee have suggestions for work groups that should be started? Go ahead, Michelle. I'll recognize you first.
You're going to hear this over and over from me. Accessibility, the disability community, from collecting data, we're providing services, providing the accommodations. All of that is, there needs to be more attention to it.
Thank you, Michelle. Thanks, TJ.
Hey, thank you, Richard. I just wanted to share a few work groups that are actually coming up right now, in case anybody is interested. So there are 4 that I'm aware of that are really on the horizon or already started. So one was mentioned by a member of the committee from CBI. So PSH Work Group, or Permanent Supportive Housing Work Group, that's really going to tackle some issues like the transfers in HMIS, but also things like, why are some of the housing numbers really low? Really getting some qualitative information there. The second one is a learning management system. So that was presented to this committee previously, but many of you may be new. There is a learning management system that is being developed where we would store trainings. And Michelle, I would really much so appreciate someone like yourself to be added to that work group to ensure that the learning management system has accessibility and is built to ensure that whoever is trying to access the information can, but also anyone else. That has started, and we've had a couple of meetings. The next one is move on strategies. This is a work group that paused because of COVID. So this is people who are in permanent supportive housing, who no longer need as intensive supportive services, but still need subsidies. So how can we transition them from a PSH unit to shift into partnership with our public housing authorities to be able to open up a voucher for more supportive services? That is something that has not yet started, but we're interested. And the last one is through the Coordinated Entry Subcommittee, which is domestic violence and coordinated entry, trying to better integrate and ensure that there's a lot of different things there. So I'm not going to go into all the details, but to just make sure that people experiencing domestic violence have equitable access to the resources that are available through the Continuum. So I know that was a mouthful, but those are 4 that are either started already or upcoming very shortly. So if anyone's interested in that, please just note it and we can reach out to you.
Thank you,
Thanks,
CJ.
Richard.
Thank you. Do we have any others? Okay. And in the chat, Jim has said regarding the link, he said, let me check and maybe an internal dashboard. I'll definitely share the names of the people who presented at yesterday's PCA meeting. PCA agenda item equals Arizona Judicial Council Court Navigator Program update. Presenters, Teresa Barrett, Court Programs Manager, and Bert Cisneros, Research and Statistics Specialist, Arizona Supreme Court, Administrative Office of the Courts. And then, yes, so TJ also says, thank you, Jim. Do you have an email address for them? So they're digging through those emails. If there are no
folks, sorry, Richard. Can you all please stop using the chat? This isn't publicly available. And so I know you all have access, but the public does not. So if we could handle this via email, that would be great.
Yes, because then I end up having to read them all so that the public can hear about it. But yes, so if there's no other comments, then we'll move on to the next and the last agenda item, and I will give that back to Wendy.
I agree with TJ. This has been a delightfully engaged meeting with all of our committee members, new and returning. And we want to keep this moving forward by ensuring that the topics we discuss and the agenda items that we spend time on are ones that are relevant to what we're trying to accomplish as a group. So at the end of every meeting, we're going to ask for topics of interest that the Maricopa County Regional Continuum of Care Committee can add to our future agenda. You're not limited to doing it right now today. It's not a test, but it is an opportunity for you to put some thought into stuff. You can email Katie, Richard, and I with any ideas. We've already gotten a couple of emails from committee members, but is there anything right now that you would like to see added to the agenda?
Hi, this is Jim again. And again, kind of a newbie question. When Katie was giving me the onboarding of being on this committee, she gave me this table of organization. I was looking at it, and there was this regional, continuum of care board, and we are the regional continuum of care committee. And I just thought, okay, what's the difference between the two? And why are the names so similar? And I'm just thinking maybe, a little bit of clarification on, the name of our group versus the board to help newbies and maybe the public.
Jim, that's an excellent segue to a comment I was going to make, which is we talk in acronyms and shortcuts. And we have intentionally invited people to be a part of the committee and to present at the committee who don't speak in acronyms and shortcuts. So as you are presenting or talking, TJ threw one out today, the HIC list. I don't even know what that is. So anytime you can help with that. Jim, the board oversees I think right now, 6 committees that include us, which are the boots on the ground. The board is an oversight group, a governance, like a nonprofit governance kind of role. They represent maybe municipalities, larger organizations, policymakers, that kind of stuff. We are definitely the doers, and that's what we want to encourage. I'm having some network instability, so if I sound like I'm underwater, I apologize. I look forward to you calling out those items as we move forward, Jim. It's good to have a voice of someone who's never heard some of this. Anyone else? Okay, well, we're.
Marcy put her hand up.
Sorry, I was having some technical issues getting my mouse to work. Also a newbie question. So Jim, you're not alone in this, but we talked a lot in this meeting about communicating out to, the public at large. And, I certainly want to encourage any discussion when we talk about educating people outside of our realm of housing providers. We are all in this work every day. But there are so many people in our community who don't understand the language we're speaking. And to Chayla's point, they only see the people who are out panhandling or the tents or the people out in the community. And so I really would like to see if there isn't a work group or subcommittee already on what, creating a vehicle for our communication out and our education out to smaller areas, whether it's, Metro Phoenix. Yes, there's a big population there, but also out to Surprise and Glendale and Peoria and all of those outlying areas around Phoenix as well. If we can have a group that talks about, what's the vehicle and how do we want to drive it? Is it television media? Is it online media? What's the content and who's our audience? So if there are groups already talking about that, I would like to be a part of that. Just putting that out there.
Great suggestion, Marcy. And we will definitely want to talk about that. That's something Craig brought up last year, Craig Tripkin on the committee, of what data can we share? How can we share it so that we're all saying the same thing? And so I think there's a need for that. And I'm all about the PSAs to change attitudes. So we'll try to figure this out. So thank you. The other, we're going to end every meeting with just comments for the committee. I'd like to thank some of our new members for asking those questions, but is there anything you would like to add at the end of the meeting?
We have Sheila's hand up as well.
Oh, Sheila, thank you.
Oh, by the way, it's Chayla. Hard to
Sheila, thank you. I appreciate that.
Just want to say at Marcy's comment, either ask formally, can that be on the agenda for the next committee meeting, and or so we can get an update on what, because I know whether that can be a subcommittee or how that can work, and we can actually have a conversation about what our communication, that people can get involved in that.
I agree. We can do that. Anyone else? Okay, well, we're 2 minutes from our scheduled close time. If there's no further business, we thank you for being a participant. We hope to see you at every meeting. Don't hesitate to reach out to other members of the committee for additional support or information. And as always, Katie is our anchor at MEG. So feel free to hook your ship up to her. All right. On behalf of everyone and Richard and myself, thank you for your participation in today's meeting. It's been a gas. Thank you. The meeting is now adjourned.